You're still watching the City Newsroom on City TV, still on the new variant of the COVID-19 pandemic. We are now at the Greater Accra Regional Hospital to speak to the case management lead for the pandemic here at the hospital to give us more perspective. You're welcome to the City Newsroom, sir.
Thank you.
First of all, help us understand, what is this new COVID variant really?
The Delta variant is the new type of COVID-19 virus. We call it variant because the virus, they mutate, they change their forms as time goes by. And this one, according to the experts, is 50% more virulent. That is more stronger to affect or infect people than the Alpha variant, which was identified in the UK. We all realized that about a month ago or two, India had an outbreak which nearly devastated, overwhelmed their healthcare system. So it was the Delta variant, which, like I said, is more virulent, stronger than the previous one. So this makes it more serious if we should get outbreak in this country.
So where do we stand as a country with regards to this variant?
As a country, I think for a couple of weeks back, we identified this variant, the Delta variant, in the country from Noguchi. So since then, they have been monitoring. The surveillance has been high, and it looks like we are having pockets of outbreaks in the capital, in Kumasi, Accra and Kumasi. So the numbers are actually going up from our public health lab reference areas. So the numbers are picking up now.
Now, the mere mention of the Delta variant sends shivers down the spine of a lot of people. Should we be worried as Ghanaians?
Yeah, you should be worried, because for the fact that we have this variant which is virulent, stronger than the previous one, even if you have one case, you should be public health concerned, because this one can spread faster than the first one. So that's why you should be worried if we have few cases in the country.
So tell us, how different are the symptoms with this Delta variant from what we've always known about COVID?
Yes, from what we are observing on the ground, the symptoms are a little bit a slight difference from the one we knew before. The one we knew before started with a fever, coughing, dry cough, sore throat, and having traveled from endemic area. Now, Ghana is also an endemic country, so you don't need to travel to be diagnosed of COVID. Additionally, the classical symptoms, you are not seeing them. What we see, the first one is headache. When we complain of headache, they may not be coughing. Stuffy nose, and sometimes unspecific symptoms. That means things which we may not think is COVID as we knew before. They may get some sore throat, but it's not as prevalent as before. The fever is even one of the last symptoms we are seeing these days.
How do people who have been vaccinated react to it, and where does it place people who haven't even been vaccinated at all?
Surprisingly, we just walked into the COVID ICU. Currently, the patients we have, 5 of them, none of them has been vaccinated. So it shows that the vaccine has some sort of protection from getting to the ward for admission. Maybe if you are vaccinated and you get infected, your symptoms may not be so severe, you may not need hospital admission. So the 5 people in the ward clearly tells us that those who have not been vaccinated are at higher risk. Additionally, those who are in the ward realize that they are elderly people with underlying conditions. When many more people are vaccinated, especially those who are under underlying conditions, I think if they get infected, they may not get to this stage, which will require hospitalization.
Thank you very much. That was Dr. Ahiabli. He is the lead for the COVID-19 case management team here at the Greater Accra Regional Hospital. We cross over now to the Ghana Health Service press conference earlier, where they have provided some more details and perspective on where we stand as a country with regards to the new COVID variant.
There's been a gradual increase in the active cases over the past 4 weeks, as we are all aware. We have more than 2,000 active cases. And we have an average case count of about 120 cases, mainly in Accra, Greater Accra, and Ashanti. Severe and critical care cases still, however, remain low, but it's not like, let's say, 4 weeks ago. We are having some increase, but still not high. Greater Accra and Ashanti regions are the driving the outbreak in the country. Almost all the cases are in this. Once in a while, we have a few cases in Eastern and other places. We have report outbreaks. Mainly, this outbreak has been more of clusters. We have them in schools and workplaces. For the past 6 to 8 weeks, we've not had vaccination, and that's one situation. And as we are all aware, adherence to protocol is generally low. And this is a call that we need to be able to take that seriously, especially in the wake of the current changes. As we speak now on our dashboard, we have 2,512 active cases. And as we understand, that is the number of people who are currently carrying the virus, with overall positivity rate of 7.3%.